All right, welcome to this live. I want to make sure that things are working. If you are joining me live, go ahead and send me a wave, send me any questions that you have. And today we're going to continue the conversation about how to support your fertility naturally. And you guys, the thing that I want to be really clear about is because I have a bunch of you messaging me, a bunch of you in a place of desperation. Help me. I don't know why I'm not getting pregnant. I'm doing all the right things, or I don't even know what to do. I don't know where to get answers. And there's the voice of, I have no idea what's going on in my body. So the way my message and the thing that I'm really passionate about and the thing that I really want to educate you on is to empower you, to help you feel more in control of your health, more confident in your body, so you can tap in and connect with your fertility potential. We as females have a fertility potential, and we're going to talk about that through the menstrual cycle, but it's going to reflect very deeply on what's going on with our health. So in the same sentence that we say, I don't know why I'm getting pregnant, but then I'm on thyroid medication, I'm using this to regulate my blood sugar, I have a bunch of inflammation, I am 50 pounds overweight and I can't seem to lose that weight. Those are all markers to tell us that something is off with your health. And it's a protective, and it actually is a way that's telling us that you're not managing stress very well. And there's a deep hormonal issue that's going on, whether it's your blood sugar dysregulation, your thyroid, weight, which is usually can be a combination of a blood sugar dysregulation, thyroid, or cortisol. It's all going to impact your ability to be able to conceive naturally and to carry that pregnancy to term. Because remember, pregnancy is the hardest thing that the female body will ever do. And so if the body is stressed out, if it's inflamed, it can't regulate blood sugars, it's going to be very difficult for it. I'm not saying it's impossible, but it's going to be very difficult for it to get pregnant and to sustain that pregnancy. And so what I want to teach you and educate on is how to take control back of your health so you can feel vibrant, you can feel energetic without relying on medication and without feeling like if you don't take this or do this, then your system doesn't work. Even things like, well, my progesterone is really low, so I need to take progesterone. You might need to take progesterone, don't get me wrong. But the bigger issue here is understanding why your progesterone is low and always working towards figuring that out and finding a treatment that's going to solve that, because there is issues. There is so many things that we can do to support your progesterone levels or your thyroid levels or your metabolic, and they're all associated with our lifestyle. They're associated with taking supplements, doing some detoxification protocols, and generally means working with a professional. Yes, because you're being guided through something that you've never done before, as opposed to just going to the doctor and being told that your lab work is normal, which it might be if only 10 things are being tested. And that's really just not indicative. It's not enough information, and it's not validating your symptoms. And in fact, it's teaching you and telling you that it's okay. It's okay to not feel this way. It's totally normal. And I'm telling you that it's not. And that's why I'm here. That's why I want to educate you on these pieces of the 9 markers of health that I need you to start paying attention to and figuring out, so you're not blindsided by the fertility issues, and also you know where to go and you know to advocate for yourself. So if I share my screen really quickly here, you should be able to see the 9 markers of health here. So basically, right, we have gone through a bunch of these already, and that's really, really great. So let me see if I can draw on this. Okay, so we've gone through stress, we've gone through nutrition and diet, we've gone through digestion, and we've gone through movement. So we still have 1, 2, 3, 4, 5 left. Today, I want to attack the mood. Okay, and then we're going to go through how to track your menstrual cycle, how to actually, what your menstrual cycle is telling you about what's going on the inside, and how, because this is obviously the best, the tool that will tell you if you're fertile or not. How to hydrate properly for fertility, things that are underlooked a lot, that this is, I'm just drinking the water and I'm good, but there's some secrets that I want to reveal for you, as well as what your energy level and what your sleep is going to tell you about your ability to reproduce and to be able to sustain the pregnancy to term. So let's talk about mood. Mood is this big one. And really when I talk about mood, what I mean is, and we have a lot of mood issues nowadays. My pen is acting up. We have anxiety, we have depression, and then irritability. Okay, this is another really big one. There we go. I'm not sure why it's acting up, but this is what it is. So we're all in certain parts of our life, if you will, experience fluctuations in our mood. And that's actually totally normal. It's normal to feel some levels of anxiety. It's normal to feel sad, icky, depressed. It's normal to feel like you're irritable because it's not, the point is not to be no emotions ever. The point is to be able to feel emotions, understand where they're coming from, allow them to pass through you, and then move on. Where we get into trouble and where it becomes your mood is when you actually get stuck in those emotions. So when you stuck in being depressed for a long period of time and you feel like now it's impacting your day, you're not able to get your work done, you're not able to be present for your partner or your friends or your family members, whatever it is, and it's starting to impact your everyday life. That's the same with anxiety. You're now not able to get things done or you're getting panic attacks. And now we have to figure out how to help you manage that. And of course, the conventional medical system is just going to prescribe you medication because the conventional medical system is trained really well in pharmaceuticals. And there's times when we really need the medication. And kind of the biggest frustrations that my patients have and that I see in the industry is that you just get prescribed a medication without a long-term in mind. And there is no explanation as to why it's happening to you. What can you do to prevent it? And you're just kind of basically left at that. Take this medication, you're going to feel better, and then move on. What we want is we want to feel supported during a time of crisis. Okay, so we might need a medication, and that's a time of crisis. If you're having panic attacks and you can't go outside, you need something to help you go outside because that's an important part of your day. I'm sure it's an important part of your day. The same with depression. If you're having suicidal thoughts, we need to address that ASAP. But once you have quote unquote stabilized, and even if you've gotten some help, so most of my patients come to me, they've already gotten a bunch of therapy and counseling, and they're trying to, figure out their triggers and heal their traumas and trying to, overcome some of the issues that they're dealing with in their life. But the problem is, the mistake that we make is that there is no plan to come off. You're just kind of stay on this thing. And why would you get off? Because it makes you happy. Regulates your mood. But here's the problem when it comes to fertility. Your mood, actually, the mood that you're experiencing on a regular basis actually tells us what's going on in the physical body. And I'm going to share my screen one more time so I can draw it out. But basically, when your mood is off, and whether it's your anxiety or depression, it tells us a couple things. It tells us about your gut function. Let's see if I can not draw. It tells us about your gut function. It tells us about your hormone function. And it tells us about your neurotransmitters. So what's going on with serotonin, dopamine are a big one, which are impacted by, hormone and gut function, how well you're detoxifying, how well are you absorbing nutrients? Do you have enough nutrients? Do you have a nutrient deficiency? For example, having low iron and low B12 is a common sign of anxiety, and it can cause depression. Anxiety and depression kind of go hand in hand. I think it really depends on the person in terms of where they are in their life, but our mood tells us something about the physical health. And this is really the approach, if you will, as an alternative healthcare provider, where you're not just looking at the physical health and you're not just looking at the mental or the emotional. You're looking at all three, because all these three things are intertwined. And I always say, if sometimes the thing that's causing us to feel more anxious and overwhelmed or depressed are things that are physically happening in our world. So for example, losing your job or having a stressful project at work, not being able to get pregnant, right? That's a really stressful environment, but a stressful thing to go through. But if you have low B vitamins, right? Or if you have gut bacteria that's causing a bunch of inflammation and depleting your nutrients even more, and causing a lot of distress with your hormones, there's no amount of meditation and no amount of counseling that you can do to bring up your B vitamin levels. Okay. And that's just kind of the component that what I really like about the alternative in my approach, if you will, because I know that we are all different, is to connect those three things together. So your mood is very much a symptom. It's a symptom. It's a way that your body is talking to you. Is it something that we need to, I don't want to say like cling on to? No, the point is to understand where it's coming from and genuinely get the help and the support that you need, but really be more curious and ask the deeper questions as to, why do I continue to feel this way on a regular basis? And is it possible that there's something else that's causing this issue? So what I commonly see now is we actually use substances to help us regulate our mood. And so whether it's alcohol or drugs like weed is a really big one to help, especially with anxiety, to chill you out. But that has a negative implication on fertility. And if you watched my Blueprint to a Healthy Pregnancy in the guide section, if you want to watch it, just go ahead and comment Blueprint and I'll tag you in that video. But there is a negative impact on fertility if you're using those substances. For both males and females, it's impacting the quality of your egg, and it's actually stressing out your system more, even though the immediate effect is the feeling of relaxation. And the question really becomes about, why do we need that feeling of relaxation? What's going on in our life, in my day-to-day? Maybe it's in my diet, maybe it's lack of exercise, maybe it's too much exercise, maybe I'm in the wrong group of friends, maybe I'm in the wrong relationship. Whatever it is, those are like the really deep questions that we need to ask ourselves. And like I said, in alternative medicine, I really like bringing all of those three things together, because sometimes mentally, emotionally, I'll have patients who are very well grounded and they understand exactly why they feel the emotions and when they feel them, but they still will feel anxious and depressed. And this is where we can rely on things like lab testing to figure out, what are you actually deficient in? What is happening in your gut? What is happening with your hormones that's triggering you to feel the anxiety? Which brings me to that last point, is that anxiety or depression is really just a symptom. And it's a symptom, and a symptom is just messages that your body is talking to you that something is off. And if we didn't have symptoms, we would never do anything about it. So symptoms is a thing that pushes us to do something about our current situation. And it's just that the question is, how much do you need that symptom to be? How big do you need that symptom to be in order to do something about it? So some of us can gain 10 pounds and feel uncomfortable, and some of us will say that's normal and wait until it's 50 pounds. And sometimes it's 100 pounds because you're just kind of think that it's normal. And so my goal with this whole group is to stop normalizing things that are not normal, so we can stop seeing such a decline in our health and therefore a decline in our fertility, because that is the trend that we're seeing right now, you guys, and we need to reverse that. And the way that we reverse that is take that control of our health back, start feeling confident again in our body, understanding how our body works, what our body's trying to tell us, and most importantly, how to take care of it. So when you understand how it works and how to take care of it, then it starts to flourish, and that transfers and that translates into fertility. And so again, when you're freaking out about not being able to get pregnant or not being able to sustain a pregnancy, what I encourage you to do is just go inwards and ask yourself, what are some of the things that could be going on that are preventing me from being able to do that? So we're not focusing so much on getting pregnant or sustaining the pregnancy, but we shift that focus towards ourselves and towards getting really healthy, nourishing ourselves, getting the support that we need, and having somebody who's going to help you figure that out along the way. So for the mood, it's important for me, for you guys to understand that your mood is really just a thing is a symptom, and it's a message that your body is trying to send you. And a lot of the times we have things that are off that once we fix them, the symptom will go away. And it's really about just having the courage to go through the process and not get scared off by the initial kind of anxiety and depression, and separate yourself from those emotions, because you are not your emotions, you are experiencing those emotions. And so if we can separate ourselves, then we can be a little bit more grounded through the process. Okay, so to summarize really quick, as we're running out of time here, we've completed a bunch, right? We've talked about the stress, the movement, the digestion, and the nutrition, and today we covered mood. And the summary with the mood is that depression, anxiety, irritation, whatever the mood that you're feeling is actually a sign. That's your physical body talking to you. And usually when we go inwards, we can learn and understand what those moods are telling us. Maybe it's we are a little bit tired, maybe we're dehydrated, maybe we haven't eaten enough that day, we didn't sleep enough. And so it's a sign that shows us how we need to take care of ourselves. And so instead of brushing your mood off and just saying, oh, I'm anxious, oh, I'm depressed, or I'm this, I invite you to go in a little bit deeper so you can start to connect the dots. Because when we have an explanation as to why things aren't happening, we feel a lot more at peace. And then we can make a plan. Then you can have an action plan moving forward. Okay, so that's it for today. And basically what we have left is sleep, energy, hydration, and menstrual cycle. And all those things are very, very important. And of course, typically, it's not just one thing that's impacting our fertility. We are complex beings. So all of this is why I'm taking one by one into the guide section. You can go through and watch some of the previous ones, and then log on live or rewatch these when you can. If you want the handout that I just showed you, just go ahead and comment markers for health. And what I'd love for you to comment after you've watched this video is what was the most kind of interesting and intriguing thing that you learned from this video. And I'm looking forward to connecting with you guys through the comments and just seeing what you are loving and learning. Okay, thanks so much. Much love. We'll see you then.